My name's Christine Pollard. I have a master's level in horticultural therapy. I belong to the American and Canadian Horticultural Therapy Associations, and I offer the Home Farm Horticultural Therapy Certificate. I developed a horticultural therapy certificate. It's for persons that want to add the horticultural therapy knowledge to their previous experiences and training, maybe for career changes to complement what that person already has. The Hort Therapy Certificate is 160 hours. It begins with an introduction. It takes you through the techniques that you need to gain to be a horticultural therapist. It takes you through program planning. It takes you through your connection with the community and community development. And it goes through some special populations and their particular needs that horticultural therapy can address. Horticultural therapy is the use of plants for a specific purpose to contribute to a care plan or to a rehabilitative plan for an individual. There's been some wonderful studies done where just the view of a garden can lower our blood pressure. It lowers the amount of pain relief we might need after an operation. It will even reduce complications from surgery as well, just having that view. And that's not even working in the garden. So horticultural therapy is a tool for rehabilitation. It's also a tool to maintain the health that we already have to prevent deterioration. Lots of folks think that horticultural therapy is a new therapy, and it's not. But I think it feels new because we're using it in so many different ways. When we've had a major illness or injury, we tend to disconnect from family, friends, work. We're not quite sure how to define ourselves. And horticulture can be a redefinition of who you are. You can not be a person with limitations or barriers. You can be a gardener. So it opens up a whole new world for us and a whole new reason to be connected and activated. Safety is all about your attitude and the way you present yourself as well. No one is going to stick their neck out, decide to make changes in their life if they don't feel safe. Making a change in our life it's scary, and it's easier not to. So if you're going to make change, you have to be in a safe environment. Horticultural therapy programs are meant to be centered around the needs of the participant. A horticultural therapist needs good knowledge of horticulture, and that basic knowledge is really necessary. Often folks you work with, if the seeds don't germinate or the cuttings don't take, because that person is vulnerable themselves, will often say that it's their fault, that the plant isn't growing or it's not doing very well. You need to have that basic horticultural knowledge so that you can offer the technical reasons why the plant didn't grow, that it wasn't anybody's fault, the plant just didn't have the right environment. These are the technical reasons, we're going to fix it. It also, having that horticultural knowledge, presents horticulture more as a profession. And the higher the value of the horticultural activity, the higher the value the person will have of themselves when they can accomplish that skill. A horticultural therapist is a bit like a farmer. You've got to be a jack of all trades. You're often the safe entry point for the person you're working with into community. You might be the person that is the contact with garden clubs, farmers markets, community gardens. So you need to have a good knowledge of your community. You need to be able to interview your participant in a relaxed and safe way so that you can find out what their felt needs are. You need to be able to interact with a health professional team. You need to be able to plan a horticulture year an individualized horticultural therapy program. You need to be able to work with the other staff in your organization, especially the maintenance staff if you're wanting to plant gardens, who's going to look after them. You need to have a good relationship with the kitchen staff so that you can get all the goodies and vegetables for your vermiculture, your compost pile. You need to work with administration. You need to know the mandate of the organization so that you can write proposals. The facility and the organization need to meet their needs. They need to know that they're providing quality service. So you have to be able to describe what you do, and so the administration can allow you to do that. If you're working with a special population and the person you're working with has a specific goal, then it's up to the horticultural therapist to think about what that goal is, whether it's to be more sociable, whether it's to increase their physical abilities, or to maintain their cognitive abilities. It's our job then to orchestrate a horticultural activity that will meet the goals of the individual. Don't get hung up on what the disability is. Look past that and make sure that you're concentrating on that person's abilities and build on those. So we become part of that person's care plan. We would work with other members of a care team, and we would orchestrate that horticultural therapy to stretch that person physically, to maintain their cognitive abilities. And so it's a planned, intentional horticultural activity. It's also the job of a horticultural therapist to document those the changes they might see in somebody. We can offer observations just on that person's attitude that day, their ability to cooperate with others in the group. We can offer a lot of insight into how that person manages just on a day-to-day basis doing routine tasks that maybe the rest of us take for granted. So horticultural therapy is planned, it's deliberate, and it's documented. I've been very lucky with the folks that I have worked with in the past, and I need to say that everything I know as a horticultural therapist, I've been taught by the people I work with. If you're willing to listen, and you need to listen, then folks will tell you what they need and how you can be supportive and helpful. In the next 5 years, we're going to see some really big changes. The interest now in horticultural therapy education is growing. Employers will employ horticultural therapists if they know there is formal education available. We can't expect employers to employ as if we don't have that piece of paper that tells us that we have those qualifications. So I anticipate some big changes in hort therapy and the availability of employment in the next few years. Horticultural therapy started significantly as a therapy. That's not again. It's hard.
It's very hard.
Like you're trying to organize your thoughts.
Yeah.
Not do Try not to giggle.
That's right.
Being active and connected again.
That's really good.
Great. That was a good
You're
one.
moving into,
That was a good one.
That was
beautiful.
I'm warming up.
Good
That was a keeper, right? Yeah.
That was a keeper. You guys are great.